Good afternoon, professor and classmates. Let us introduce ourselves. My name is Ayon Maite and my partner is Leighton Ricardo. We are studying at the Catholic University Santiago de Guayaquil, where we study medicine. Today, we are going to talk about diabetes and its types. We have chosen to speak about this because we think it's an interesting and good topic. It is one of the most common diseases worldwide, and at the same time, it is important to know the great impact of this disease. If diabetes is not treated in time, it can have irreversible consequences. Also, it is necessary that people know that by changing their lifestyle, they can prevent developing this syndrome. In addition, it is important to know that there are 3 types of diabetes that all we need to learn. Our talk will last about 6 minutes with 40 seconds. Diabetes is considered a silent disorder that has affected some 400 million people worldwide, where some die from complications. Good pharmacological treatment prevents and reduces possible complications into reducing mortality. Complications of diabetes can be acute or chronic, including stroke, blindness, heart disease, such as heart attack or heart insufficiency, renal insufficiency, and other complications. Also, the quality of life of this patient improves notably with anaerobic or aerobic exercise and healthy diet such as fruits, vegetables, proteins, and drinking water. We have broken our space down into 3 parts. At present, diabetes mellitus is etiologically classified into type 1, type 2, and gestational. There will be plenty of time at the end of our speech for question and discussion. In the first place, type 1 diabetes mellitus is a common disease in childhood, which there is a destruction of a pancreatic beta cell, where the pancreas produces little or no insulin, resulting in high blood glucose. The typical clinical presentation of diabetes is polydipsia, polyphagia, polyuria, debility, unintentional weight loss, nausea, hyperglycemia, ketonemia, diabetic ketoacidosis, and other symptoms. As for treatment, there seem to be 2 possibilities for dealing with this. The first option is a hormone replacement treatment, where insulin is administered to the patient. And the second option is a alternative treatment, where the patient must change their lifestyle with exercise and strict dietary care. That is all I would like to say about type 1 diabetes mellitus.
Diabetes mellitus. It manifests with hyperglycemia due to insulin resistance and abnormal insulin secretion. Is the prevalence is related to obesity and sedentary lifestyle. Is occur more frequently in adults, can sometimes be asymptomatic, but usually present the same symptom as type 1 diabetes, and a simple blood test reveals the presence of the disease. If pharmacological treatment is metformin, while I try to show in this part, the patient does not need insulin, but may need in an advanced stage of the disease. That's all we would like to say about diabetes mellitus type 2, and now let's go straight to diabetes mellitus gestational. Gestational diabetes mellitus, as you are probably aware, also occurs only during pregnancy and can cause the problems for the both mother and child. It usually has no symptoms. In some cases, polyuria and polydipsia are reported. In short, possible related cause includes genes and hormonal changes of the pregnancy. Treatment consists of the daily blood sugar monitoring and healthy diet, exercise, and monitoring the baby. But if the blood sugar level is too high, medication is necessary, insulin is used. That's all we would like to say about diabetes mellitus gestational. So as we have seen today, diabetes is a silent metabolic disease which consists of uncontrolled blood glucose level. which can appear at any age in even the pregnant woman. So we must be alert if the characteristic symptom of diabetes mellitus type 1, type 2 diabetes mellitus, or gestational diabetes mellitus are present. Do not forget that the treatment of this diabetes is important to be accompanied by physical exercise and a good diet. We would like to finish by reminding everyone that it is essential to distinguish the different stages of the diabetes in order to correctly diagnose a diabetes patient and administer their treatment. Type 1 diabetes mellitus is prominent in childhood. Type 2 diabetes mellitus is more common in adults, and gestational diabetes occurs only when the patient is pregnant, which is mainly based on the nutritional aspect, which the specialist should consider. In addition, it's essential that all these patients change their lifestyle through the frequent exercise and the healthy diet according to the norms to reduce weight, improve the insulin sensitivity of the whole organism, and those help control diseases as well as reduce possible complications. Okay, teacher and class, thank you very much for your attention. If there are any questions, please feel free to ask it.